Glucose or glucose is the body's essential wellspring of energy. It is typical for your glucose to change for the duration of the day. While your glucose or glucose will change inside a specific reach, it can begin to become hazardous once it dips under the restrictions of what's viewed as solid. Having low blood glucose, otherwise called hypoglycemia, happens when your blood glucose levels drop so low, you should begin hypoglycemia. The board intends to raise them back up to a typical level. While you may have to converse with your doctor about your very own objective glucose levels, the typical level where hypoglycemia begins is 70 mg per deciliter. Manifestations of hypoglycemia. Having low blood glucose can happen rapidly. Notwithstanding, the manifestations of low glucose can differ from individual to individual. It is important to have hypoglycemia. The executives plan to set up to perceive the manifestations of low blood glucose before the indications become extreme. A portion of the regular indications of low blood glucose include feeling unstable, being apprehensive or on edge, perspiring, chills, and dampness, touchiness or eagerness, disarray, quick heartbeat, feeling bleary-eyed or dazed, craving, queasiness, shading depleting from the skin, paleness, feeling sleepy, feeling powerless or having no energy, obscured, impeded vision, shivering or deadness in the lips, tongue, or cheeks, migraines, coordination issues, awkwardness, bad dreams or shouting out during rest, seizures. To affirm that you are experiencing low glucose, check your blood glucose with a blood glucose meter. Having hypoglycemia is generally an aftereffect of treating your diabetes through medicine. Nonetheless, on the off chance that you have not been determined to have diabetes yet or encountering the indications of hypoglycemia, you should see a specialist right away. When you begin to arrive at lower levels of blood glucose, your body begins to deliver adrenaline, bringing about hypoglycemia manifestations. If these levels proceed to drop and your mind needs more sugar to work, you may begin to encounter slurred discourse or move awkwardly. Individuals encountering serious side effects regularly seem inebriated. Whenever left untreated, hypoglycemia can prompt seizures, a state of insensibility, or even demise, because of the absence of energy being provided to the mind. If you notice that you are encountering indications of hypoglycemia, don't drive or work apparatus. Set your hypoglycemia. The board intends to work and pull over and check your glucose levels. On the off chance that your glucose is low, eat sweet food, for example, candy or natural product juice. Stand by in any event 15 minutes in the wake of eating before you check your sugar levels again, and on the off chance that they are back in the ordinary reach, you should be okay to drive. Hypoglycemia unawareness. Even though they are horrendous, reoccurring manifestations of hypoglycemia caution you that your present hypoglycemia. The executive's plan should be adjusted. Notwithstanding, encountering hypoglycemia more than once over the long run can bring about your body creating hypoglycemia ignorance. Hypoglycemia ignorance happens when your body quits reacting to these indications of low blood glucose. The outcome is an expanded danger of perilous manifestations happening when your glucose levels drop, since they don't realize they need to treat it. On the off chance that you experience the ill effects of hypoglycemia ignorance, you need to ensure that you're routinely checking your blood glucose levels if you have diabetes. If you experience the ill effects of this condition, consider getting a constant glucose screen that will blare when your levels are falling. That is brilliant hypoglycemia, the executive's plan. Likewise, let your PCP know whether you think you have it so your supplier can change your glucose focuses to maintain a strategic distance from future scenes of hypoglycemia. Additionally, on the off chance that you are habitually encountering low blood glucose or have hypoglycemia ignorance, particularly on the off chance that you use insulin, you ought to think about wearing a clinical ID consistently. During a crisis, your ID can give crucial data about your clinical status, the kinds of drugs that you use, regardless of whether you have any hypersensitivities, and whatever other significant data is required for treatment. Luckily, it is conceivable to recover early notice side effects in half a month through hypoglycemia. The board. By evading low sugar, your body re-figures out how to trigger any admonitions that your levels are low. This can be accomplished by raising your objective glucose level with your doctor. Your A1C levels may increment briefly, however you will recapture the capacity to recognize low blood glucose levels. Reasons for hypoglycemia. It is essential to see how the body measures glucose to see how hypoglycemia occurs. At the point when you eat, your body changes over the carbs that you eat into glucose, the principal wellspring of your body's energy. Notwithstanding, blood glucose can't enter your cells without the assistance of insulin. It permits glucose to enter the cells and give the energy to work, and on the off chance that there's an abundance left finished, it is then put away in your muscles and liver as glycogen. At the point when you haven't eaten for some time and your glucose levels drop, your body's own hypoglycemia, the board plan, becomes effective and advises your pancreas to deliver a hormone called glucagon. It advises your liver to deliver the additional glycogen being put away. This is the way your glucose remains inside your typical blood glucose range. Be that as it may, if you are a sort 1 diabetic, you don't make enough insulin, or in case you're type 2, you're less receptive to it. Thus, you end up with over-the-top measures of glucose in your circulatory system. This is the reason you should take insulin to control your levels, yet unintentionally taking an excessive amount can bring about your low blood glucose. Notwithstanding, individuals who don't have diabetes can likewise encounter hypoglycemia, even though this is more uncommon. This can be because of diet, exercise, medication, or diseases. Medication. Taking somebody's diabetes medication can bring about somebody encountering low glucose. Additionally, on the off chance that you are a youngster or have kidney issues, treating jungle fever with quinine may likewise make you experience this condition too. Additionally, some pneumonia prescriptions are known to cause hypoglycemia in certain patients. Liquor. Binge drinking liquor can likewise prompt encountering hypoglycemia. This is because of alcohol's capacity to hinder the liver from delivering glucose into your blood. This normally happens when you drink on a vacant stomach. Constant conditions. Having a liver illness can cause your blood glucose levels to drop altogether. One explanation is that liver problems can keep your liver from delivering your meds into your circulation system, causing a development that influences your glucose levels. Additionally, if you experience the ill effects of anorexia and aren't eating appropriately, you can encounter an absence of glucose because of the non-attendance of substances expected to create glucose. Hormone lacks. Having messes in your adrenal organs may influence your glucose creation. This is because of an absence of cortisol, which raises your glucose. Additionally, kids who have a development hormone insufficiency may likewise encounter hypoglycemia. Additionally, on the off chance that you've seen that you get hypoglycemia side effects after you eat, you might be experiencing receptive hypoglycemia. This condition happens when your glucose drops inside 4 hours in the wake of eating a feast. It is accepted to be brought about by the pancreas delivering an excess of insulin in the wake of devouring a high-carb dinner. Even though this condition can occur in people with and without diabetes, it's more normal in individuals who are overweight or have had a gastric detour. Treating hypoglycemia. If you are experiencing hypoglycemia, there are a few stages that you can take to expand your blood glucose back to ordinary, sound levels. Notwithstanding, the best hypoglycemia the board plan will shift if you are treating introductory, quick indications, or the hidden reason for reoccurring hypoglycemia. Contingent upon your indications, your underlying treatment will be the 15-15 guideline, which will zero in on eating in any event 15 to 20 grams of sugars that will rapidly re-establish your glucose levels. You ought to pick quick-acting carbs that won't take long to change over to sugar, for example, glucose tablets, natural product juice, soft drinks, or candy. Make an effort not to zero in on nourishments that are high in protein or fats because those won't give you the carbs expected to rapidly raise your glucose level. Following 15 minutes, check your glucose to check whether your glucose has expanded past 70 mg per deciliter. If it's still excessively low, eat 15 to 20 additional grams of carbs, then check it again in an additional 15 minutes. Proceed with these means to briefly treat your hypoglycemia and raise your glucose over 70 mg per deciliter. Little youngsters will require an alternative treatment choice. They typically need fewer carbs to fix their sugar levels. Babies will require around 6 grams, babies will require around 8, and little kids should eat around 10 grams. In any case, this will fluctuate with every person. If somebody is experiencing serious manifestations of hypoglycemia, it is imperative to try not to treat them by food or drink on the off chance that they are oblivious. This could prompt them to stifle or suctioning the food into their lungs. All things considered, treat them with an infusion of glucagon or intravenous glucose into the butt cheek, arm, or thigh. Glucagon initiates their liver to deliver put-away glucose in their circulatory system, raising their sugar levels. Try not to give them insulin, which could result in even lower levels of glucose. Diabetes, insulin, needle. At the point when they awaken, they may encounter heaving or sickness. Try not to spare a moment to call 911 or take them to the closest clinic for treatment if necessary. When your glucose levels are back to ordinary, you ought to eat a full dinner to re-establish your glycogen put away in your liver. They might be drained while you were encountering hypoglycemia. For individuals who have diabetes and oftentimes experience hypoglycemia, the board ought to remember contributing to an at-home glucagon pack for crises. Loved ones should know.